Hello, everyone, and welcome to today's webinar presented by the International Society for the Prevention of Child Abuse and Neglect. We thank you so much for joining us today and appreciate all you're doing to help children during this very challenging time. Today's webinar will focus on the Caribbean perspective on how COVID-19 has impacted children. Our speaker, Jamaican child rights attorney and newly elected ISPCAN counselor, Diane Gordon Harrison, will focus on three main areas. First, she will discuss the available data on cases and reports of all types of child abuse since the onset of the pandemic, especially compared with the similar period in previous years, as well as the response of governments and NGOs to this data. Then, with the major concerns in the Caribbean about access to education, she will describe the impact on teaching and learning during the pandemic and methods introduced to assist children. Finally, she will highlight concerns surrounding children and social media during COVID-19. Right now, I have everyone on mute to avoid background noise. We welcome you to please enter your questions and comments in the questions box throughout the presentation. Diane will respond to these at the end as time permits. The recording of the presentation and slides will be posted on the ISPCAN website for limited time after the webinar. Then they will be archived and made available for members only. Diane Gordon Harrison is a newly elected counselor for ISPCAN and served as co-chair for the ISPCAN Caribbean Regional Conference in Montego Bay, Jamaica in 2018. She is an attorney specializing in criminal litigation, civil law, and children's rights. Diane serves as head of the Office of the Children's Advocate, an independent commission of the Jamaican Parliament that focuses on protecting children's rights by providing legal representation, canvassing to get children's views on matters impacting them, and advising Parliament and ministers on law and policy. She is also Jamaica's national rapporteur on trafficking in persons, observing and assessing anti-human trafficking strategies employed by the government to determine effectiveness and ensure that victims' rights are upheld. Diane, we thank you so much for being with us today. Now I will turn it over to you. Okay, and Diane, make sure you're unmuted.
All right, good morning, everyone, or good day or good afternoon, depending on where you are in the world. Thank you, Heather, for the very warm words of welcome. It certainly is my pleasure to be here sharing with ISPCAN, and not only because I'm a newly elected member, but because I truly believe that ISPCAN provides a well-needed platform for persons globally to deal with issues that are relevant to child abuse, neglect, and protection matters. So my presentation, as you see, is entitled The COVID-19 Pandemic and Children in the Caribbean. Before I get into the meat of the matter, please allow me to acknowledge my colleagues and stakeholders throughout the region who have been particularly helpful in giving me access to information and data. And I'd like to specially single out two persons. Miss Diana Shaw, who is an attorney at law and legal consultant who is based in Belize, and Dr. Tracy King, who is a clinical psychologist based in Nassau in the Bahamas. All right, so first I've started off with a map of the Caribbean. Just where are we? And if you just look at your screen, you'll notice that we are, of course, surrounded by the Caribbean Sea, many of our islands. We do have some mainland ones like Belize and Guyana to the south, but generally the Caribbean really is in the center of the world, if you will. Now, let's look at the COVID-19 timeline, as I've called it, the arrival. Overarchingly, the region was directly impacted by COVID-19 in March of 2020. Each of the different island nations and, in fact, countries predominantly identified their first case, as these select countries exemplify. So Jamaica, the Cayman Islands, and Trinidad and Tobago all had their first case identified on the 12th of March. St. Lucia followed on the 13th of March, the Bahamas on the 15th, and Barbados on the 17th. So with the first cases identified, our individual governments made decisions to close the borders and hunker down to most protect the persons who were in country. So we had the Cayman Islands, for example, closing on the 19th of March, Bahamas on the 20th, Jamaica on the 21st, St. Lucia and Martinique on the 23rd of March, and Turks and Caicos on the 24th of March. What does shutting down really mean? So schools were ordered shut, or borders were closed to incoming passengers, and in many instances, this included citizens and residents who actually lived in these various Caribbean territories. Curfews were imposed on residents across the board. Work from home measures were rolled out for non-essential services. There was a general prohibition in several of our countries on large gatherings. Initially, we heard no more than 25 persons. Subsequently, that went to no more than 10 persons. And of course, all of these measures were underpinned by legal enforcement because individual states of emergency were declared in the various territories. I just want to go back to bullet item number 3 about curfews. So the curfews differed depending on the decision of each individual government in the region. But we had some very extreme ones. For example, Grenada comes to mind, where they were closed completely for an entire month. Other countries like Jamaica tended to give a cutoff time by which you had to be off the road, and then a time in the morning when you could again commence your regular business for essential purposes, the necessities of life. Now, we also had national hotlines established in the individual countries. National websites as well were created. The Jamaican website is put here as an example in brackets. We had isolation and quarantine centers established, and we also had a priority that was being paid to acquiring PPEs, that's of course personal protective equipment for healthcare workers. And there was wide-scale public health education in the various countries by the creation of all sorts of collateral material, from posters to adverts in our televisions and on our TVs and radios and newspapers, etc. And there were routine government press briefings at the highest levels. Most times the press briefings involved the Premier or the Prime Minister in each territory and or a very senior member of the Ministry of Health. Now, let's have a closer look at some of these implications that I've just indicated based on the shutdown measures. The first one I'd like to look at is the sudden school closure in various territories throughout the region. This meant a disruption of planned teaching and learning modalities, which largely are face-to-face within the Caribbean. No physical contact or socializing with friends for children throughout this period. Also, a lack of access to nutrition for some students who are at the lower end of the socioeconomic structure, who are dependent on school feeding programs run by the government. And also, some students lost a means of escape from, very precarious and uncomfortable situations at home, and school really presented an avenue for them to get away from some of the things that were bothering them. So what then are the implications of this sudden school closure? Students now found themselves with the need to grapple unexpectedly with massive change to their normal routine. And this is huge because, of course, you know that the student's week, he spends or she spends the maximum time within a learning institution, 5 days per week. Also, it led to anxiety, apprehension, doubt, and fear among students. Some students found that they have thrived better in physical learning environments versus through a screen. And also, very importantly within the Caribbean context, is that there is no internet access for some. There is no universal internet access. And so where you have students who fall within this particular cohort, it meant zero curriculum, it meant zero curriculum-based access to education. Now, just by way of example, there was a household survey done in Jamaica in 2017, and that found that at that time, 175,877 children of school age had no internet connection at home. Also, lack of access to peer groups and sharing in these groups where some children feel very comfortable can result in withdrawal or depression for some of them. And of course, we're seeing that the access to guidance counselors is lost. And this has led, as one of the underlying factors based on our assessment, to a dip in child abuse reports, which we'll explore later. The next implication, or borders being closed. This affected both visitors to our countries as well as citizens or residents, as they were all barred from entry once the borders were officially closed. For those citizens and residents who were overseas at the time, it meant separation of children from their parents or guardians and relatives with whom they have a close connection for indefinite and sometimes very long periods. The converse is also true, as in Jamaica, we do have children, i.e., persons who are below 18 of school-going age, who opt to do boarding school for whatever reason overseas. And so some of these students were in fact trapped outside of the country and could not be reunited with their families in Jamaica. What's the upshot of this? So there is fear of what may happen to the parent or guardian that the children have, especially if that parent or guardian is stuck overseas in a COVID hotspot. There is separation anxiety in the child. How soon will they be reunited with their families? How are they going to cope with their interim adjusted living arrangements, especially if this is indefinite? Uncertainty, of course, compounds almost all issues, including this, and it varies depending on the child's coping mechanism and other factors. There's an example from the region provided by Belize, where we had a Belizean mother who was stuck overseas at the time when Belize closed its borders, and she was attempting to enter Belize undetected with her young child. She was arrested on the border, and she tested positive for COVID after the test was administered by the authorities. The child was also tested and tested negative, and so we had a separation. The mother was incarcerated, and the child was placed in state care. Another of the factors, the stay-at-home or curfew orders. Now, this one is a big one because of the particular context of the Caribbean, which I'll get into in the next slide. But what we had were, in some instances, cramped spaces, which of course means that you're stuck at home. You have no privacy if it's a one-room dwelling, for example, with 6 or 7 persons. And there's also overexposure to sometimes inappropriate adult practices when children are in such close proximity to adults who may not be as mindful of the child's presence. No social distancing is possible as well in cramped spaces. And a very real fear is that some children actually may live with their perpetrator. In other instances, they may not live with the perpetrator, but with the children at home and the parents at work, especially if they're part of the essential services. Abusers have increased access to unsupervised children. What then are the implications? I'd like to put this in the context of what the data out of Jamaica showed. And this is really the latest data that is available on poverty in Jamaica, having been released in the third quarter of 2019, and it's data from 2017, issued by our Planning Institute of Jamaica. And it found that 19.3% of Jamaicans live below the poverty line. And when the comparison was done and an analysis of that comparison between the figures of 2016 and 2017, it showed a 2.2% increase. The contributors then in the analyses were identified as being caused by a drop in consumption because of reduced remittances. And of course, our data so far throughout this COVID-19 pandemic has confirmed that, again, there has been quite a drop in remittances, because persons who are Jamaicans who live in overseas territories are grappling with their own realities of having been laid off or being, subject to reduced earnings, so they're not able to send funds back to Jamaica. So remittances have fallen again, and also adverse conditions were then blamed for the jump in the poverty rate. And of course, it said that these adverse conditions, then caused by weather conditions, affected the outputs of several industries. Again, COVID-19 is an adverse condition of a different sort that has definitely affected the outputs of not only tourism, but also other sectors and industries throughout our region. So can you imagine now what the poverty rate is going to be when we do an assessment of this period in 2020? The upshot of that is that we, of course, will have increased levels of frustration amongst parents and children, depression and mental health stressors for children in these households, because even though we are focusing on the earnings of parents, in these 19.3% homes, there are children. So of course, increased vulnerabilities, such as the ones I've mentioned, make children potentially more predisposed to abuse. So that's one that we have to watch. The adjusted social practices as well is another factor. Masks are everywhere. We're sanitizing everything in sight and we're constantly washing our hands. No gatherings over 10, which means that there are no more extracurricular activities. There are missed celebrations such as graduations, birthday parties, outings with friends, play dates for the younger ones, and other events. And of course, there's postponed vacation and postponed travel, which children really do take on because they miss these normal activities. The implications, therefore, are that we have removed access to stress relievers that children both enjoy and that are positive mental health boosters for our children. And we also have a cancellation of sports training and sporting competitions across the region. And this is very critical because this means lost opportunities for sporting scholarships for students who may be scouted by universities from overseas, lost opportunities or concerns about making qualifying times for meets along the path to becoming members of national teams throughout the region. And so these concerns, both personal and educational goals, abound. Now, what are some of the numbers health-wise? Looking at the dashboard of CARICOM, and CARICOM, of course, is the Caribbean Community and Common Market, which is really a political and economic bloc of member and associate member countries throughout the region, 20 in number. We see from this snapshot that Haiti is the most impacted. In fact, Haiti contributes to almost 5,000 out of the 6,800 plus confirmed cases in the region. So that by far is the most severely impacted. But what do the actual numbers say on a granular basis? Let's look at Jamaica, for instance. We're seeing that the broad numbers quoted are not limited to adults. In fact, the age range of confirmed cases in Jamaica is from a low of 2 months old to 87 years, with the median age being 29 years old. The first child died on April 23, 2020, and it was a 4-year-old who had a comorbidity. So our children are affected. Confirmed cases in Jamaica by age group, as at July 6, 2020, we had 732 cases, and the age ranges are broken down. 6.3% of those were 0 to 9-year-olds, and 10.5% 10 to 19-year-olds. Those who recovered by age, as at July 6th, 584. Of that number, 6.5% fell in the 0 to 9 age bracket and 10.4% in the 10 to 19 age bracket. And in terms of death, we have had 1 child who has died, and that's the 4-year-old who I mentioned previously. What does Barbados show? As at Monday, July 6, 2020, Barbados had 98 confirmed cases, and the age range was 7 years to 95 years. They had 1 person in isolation, 90 recovered, and 7 deaths. Belize to date has 24 cases, and when I say to date, it's the date that's on the slide, which is June 26, 2020. They had 24 cases at that time. Of that number, 2 were children, and thankfully, both recovered. Some of the other impacts on health: postponed counseling sessions for children, shift to telephone sessions in place of face-to-face, and this obtains both with private psychologists and through the various government streams. Mental health issues were negatively impacted, and we also had a suspension of routine healthcare services, such as dental cleaning and immunization. Belize provides an example, and it was there indicated that mobile vaccine services were suspended during the time of the lockdown between March and May. And this, of course, was because the strain on the medical sector made nurses and community healthcare providers less available to address the routine needs of families and children, especially in rural communities, due to the gaps in nurse coverage for the population. The Bahamas also provides another example, and in fact, there was an article which indicated that there was a stress assessment and survey that was conducted looking at COVID-19 and stress levels. And what we saw is an increase from 15.8% pre-COVID to 24% during COVID of individuals who registered as highly stressed. Very instructive is the paragraph that I've uplifted from the Bahamian Tribune, which is the paper that published this article. And it says, previous research suggests the adjustment to online schooling for college students, and in fact, I would say all students, a lack of social outlets and uncertainty about the future may be some of the factors that raised stress in the younger age groups. More specifically, Bahamian youth are not only battling uncertainty about their education, but also economic prospects and the stress of another hurricane season following the disaster of Dorian. These combine to increase the stress of an already uncertain future. Another example from the region is provided from Cayman. Published on July 6, 2020, in the iNews Cayman paper, it says here that the Health Services Authority and the Public Health Department is advising the public that the childhood immunization program will resume starting July 2020 with an island-wide campaign across all districts in the Cayman Islands. This initiative is organized to reduce the backlog of missed immunizations following the brief suspension of some childhood immunization services due to the government's stay-at-home and shelter-in-place orders over the past 3 months. So we see that health has taken a hit. Let's look at some child abuse reports. So Belize is the first example I've uplifted, and here we focused on sexual violence. The two categories that fall within this major subgroup would be rape and what they term unlawful sexual intercourse, which really is sex with a minor or someone who is below the age of consent. And they saw, for example, when they looked at the period from January 1, 2019 through to May 2020, so all of 2019 and the first 5 months of 2020, that there was a 20% decline when they compared the 5-month period of January to May 2020 with January to May 2019. And the graph illustrates it, I believe, quite appropriately, that there was a significant dip when 2020 started to really take effect. Jamaica provides another example. And when we look at the data from the National Children's Registry, the preliminary data suggests quite a stark contrast between child abuse reports across all 8 categories. And these 8 categories, of course, include sexual abuse, physical abuse, child trafficking, child neglect, cruelty to a child, emotional abuse, psychological abuse, child labor. And what we're seeing is a huge disparity in the numbers. So it's pretty much even keel for January and February of both years, 2019 and 2020. March, you can see that there is an increase, and then April, it completely gets away from us, and there is a dip in the number of reports that we're getting in 2020 when we compare the other period. A closer analysis reveals what the numbers actually look like. So in 2019, for example, we had a total of 4,635 reports for that 5-month period that I just referenced. And in 2020, for the same period, we had 3,596. So that's an overall dip in that 4-month period, of 22.4%, as this slide indicates. In March, we saw a 29% decrease between March 2019 and March 2020. And then, as I said, in April, things got really exacerbated, and we're seeing a 67% decrease between April 2019 and April 2020. The statistics also produced by the Office of the Children's Advocate tells the same story. This office has registered and did a comparison between May 2019 and May 2020 in terms of referrals sent to the department. And what we saw was a massive dip. So in May 2019, we got 108 cases for that month. And in May 2020, 26 cases. So that represents a decline of 76%. Holding true are the statistics that come from active police cases, and this data is from our Center for the Investigation of Sexual Offences and Child Abuse in our constabulary force, and we compared 2019 versus 2020, looking at the 6-month period, January 1 to June 30 for both years. And what we're seeing here is a fall off in every single category, excepting for incest and indecent assault, when the numbers are the same for both years. But overall, it represents a 15.8% decrease between the 6-month period of 2019 versus 2020. So what has been the response based on this data that we have seen? There's a recognition that in times of crises and instability, the opportunity for child exploitation increases. That's a historical fact. And so whatever the purpose or the reason for the crisis, whether it is a health crisis, a natural disaster, an economic crisis, you name it, when there is disruption of normalcy and patterns are broken, there is increased opportunity for child exploitation. So we anticipate that there is going to be an increase. But what we also recognize at this particular stage is that while we anticipate an increase, there is going to be, perhaps in the initial stages, decreased numbers of reports, as the data has illustrated. And this perhaps is because persons are very consumed and very distracted by other things that are taking their attention away, survival, trying not to get infected by the COVID-19 virus, and all sorts of other things. And then also, because of the distraction and perhaps a lack of information, there is a perceived loss of access to outlets that they can reach out to for help. Also, this particular information, of course, informed the strategies of child protection actors throughout the region and relevant stakeholders. And there has been an increased collaborative effort, I have found, across different organizations and sectors, both individually in the various countries and across the region. So the COVID-19 pandemic really has brought life to that proverb that says necessity is the mother of all invention. So what are some of the responses? These are just some examples that I've uplifted. So the Office of the Children's Advocate, which is the Commission of Parliament in Jamaica, responsible for protecting the rights and safeguarding the best interests of children, commenced very early with an intensive social media campaign with various strands. Some of the strands include coping strategies for children, study tips that they can utilize to suitably master the changes that they're going through, effective information on how to report abuse through media that they understand, so through social media, through emails, and in fact, if they're not in a position to call, then we facilitate getting that information from them. So we receive reports. Also, information on how virtual and actual support for children across different areas of their life can be reached. And we also had to perhaps, I think, serve as a form of creative and suitable distraction, an online digital poetry competition that had them use their creative genius to focus on a topical issue and also get well-needed support in the form of tablets for schools and so on, which formed some of the prizes. Also, we had lower income community visits, both in the urban centers and in rural Jamaica, where we distributed care packages for children who are in of the most needy communities. And we're actively in discussion with UNICEF and the private sector organization of Jamaica about establishing a national child helpline that's staffed with different tiered professionals who can offer instant assistance to children, both in terms of triage and in terms of response. The very important thing about this, I think, as well, is that we have sought to use not just static messages, but we have engaged children through storyboarding, through comic book storytelling, kind of relatable messages that they can understand it because it's in a child-friendly language and also the themes are child appropriate depending on the cohort in the under 18 band that we're trying to reach. Other examples are provided by the University of the West Indies. Now, the University of the West Indies is our regional tertiary institution in the Caribbean. And in May, we had a very important teleconference that was hosted by the Faculty of Medical Sciences, suitably entitled COVID-19, Impact on Children and Families in the Caribbean Now and Beyond. And that teleconference covered a range of topics from mental health support for children, coping strategies, educational interventions that could assist them, looking at adolescents in curfew and how to treat with that, and very importantly as well, conversations about supporting parents, the roles of fathers versus the roles of mothers, and just really having a very comprehensive conversation about how to make this a better transition for our children. Another example of initiatives pursued comes from the Ministry of Education, Youth and Information in Jamaica, and they developed a strategy through collaboration and consultation with other partners throughout the Caribbean. There was also a very active partnership with international partner agencies such as the IDB and UNICEF, among others. And very importantly, what I'd want to mention is that our ministry developed an education in emergencies COVID-19 three-phased plan. So the green alert phase was one where we were just warming up, educating children about what COVID-19 was about, what to expect, how to be safe, and also teachers and parents, because they're a part of the conversation, about the precautions that needed to be observed. Then we stepped it up a notch and had Amber Alert phase. And this was when now there was the need to provide funding to schools for deeper sanitizing and putting up of signs and so on with social distancing norms so that the population could be actively reminded about what they needed to do. Then there was the Red Alert stage, which is when things got very critical. And that Red Alert stage came about on March 13th, when we had school closures across the island and we had to transition very quickly to emergency remote teaching. The ministry adopted a mixed modality approach, which saw us embracing online platforms for children, roving mobile servers, which is particularly important within our context because, again, as I said, internet service is not universally available. And so we had roving mobile servers going to communities that were least served so that those children at least could log on for hours of the day to access their teaching. We also had lessons being broadcast on television stations at specific times of the day for both the primary level and the secondary level, and also lessons that assisted our students who were doing external exams. We had a radio drama that was produced, again targeting two levels, using cartoon drama to kind of get lessons across. And the bands that were covered, of course, included science, social studies, language arts, and math. And we had printing of learning kits because, again, as I said, there are some homes that do not have access to internet, either because the infrastructure is not there or the families cannot afford it. And so there was the printing of learning kits that the Ministry of Education engaged in and distributed those through the regional offices, which are really placed and situated right across the island. So those teachers could access them and distribute them to their school population. There was also and has been ongoing teacher training and capacity building efforts to help teachers to suitably support children in this new environment. And of course, parenting support hotlines were created, 36 of them, to give parents the avenue to reach out for help and support in this very unusual time. What I'd like to mention here as well is that outside of the Ministry of Education's initiatives, we had the very innovative spirit of Jamaicans coming to the fore with some very, I think, very useful ways of people trying to just help where they were. So we had a very rural community in the western part of the island where there was a primary school that said we're going to employ motorcycle taxis to continue reaching our children. So worksheets that were aligned to the curriculum are prepared on a weekly basis. and distributed by the principal and staff to the homes of students who are not connected to online resources via motorbike or motorcycle taxis that they would pay. The learning packages were specially labeled with the students' names, which made them feel very great, of course. And there was feedback that was provided in writing and via telephone by the teachers on a weekly basis, so the children could know where they were at. We've seen teachers as well just come up with an idea to use community blackboards that are in the community to serve as a notice board, and they convert that into a community classroom so that at least those students can access the information. We've had teachers turn their living rooms into learning centers so that children can continue. And of course, our Jamaica Constabulary Force, that's our police force, not wanting to be left out, embarked on their own sort of social outreach because they engaged the Ministry of Education to find out how they could target 1,500 students across 6 of our most vulnerable communities. And so the ministry acquiesced, prepared learning packages, and these were delivered by the police 4 days per week. And again, weekly feedback would be provided to these students. So these are just some of the initiatives that have been undertaken to address the concerns in the education sector. We also had the Pediatric Association of Jamaica stepping up to the plate. And in fact, I'm pleased to be a part of their mini symposium in July here, tomorrow night, in fact, that we'll be talking about sexual abuse amongst children. And the symposium is entitled Behind Closed Doors, Sexual Abuse of Our Children. And again, this is to build awareness, to have the conversation as to what medical practitioners and in fact all of us should do if we suspect or have information that a child is being sexually violated, and to build awareness generally about issues of protection around our children. Another example of an initiative is the public-private partnership spirit that has also been awakened. So there is one I'll raise just by way of example between media, sports administrators, and the Office of the Children's Advocate. And this will take the form of a regional forum with both local and international presenters slated for this month as well. And the topic is creating a safe space, protecting our children in sport. Now, this is perhaps one that's going to be of a larger scope, but I must say that we have already had individual sporting clubs and organizations who have been throughout this COVID-19 period running sessions every Saturday morning on how to build resilience, how children can cope, and how to empower and retool parents to keep their children safe in sport in this new normal. So, having said all of this, it would be remiss of me not to bring to the fore what is a major socioeconomic influencer throughout the entire Caribbean region. Because any discussion that we have concerning children and the impact on them, particularly through this period, is going to be bullet holed, if you will, through these particular lenses. So I've sought to include it, and I'm talking about the Caribbean dependence on tourism. Now, throughout the region, much of our GDP is because of the earnings that we get is through tourism. This particular slide that I have up now shows globally, if you will, what the contribution to GDP is of tourism, what the external debts are of some of the countries, and also the estimated fall in GDP as a result of this particular COVID-19. And a closer analysis shows that the Standard & Poor's global ratings project a 60 to 70% decline in tourism in the Caribbean from April to December in 2020 when compared to the similar period in 2019. Now, this is very stark, especially when you think that the global estimate in terms of the decline in tourism is 20 to 30%. But let's look at the Caribbean's reality. One country in the Caribbean can receive anywhere between 12,000 to 20,000 new tourists per day from 3 to 6 cruise ships per day. We've had no cruise ships since February and reduced or no incoming flights up until very recently in some of the territories. which means that we have no tourists coming. And this is data that was generated in May of 2020. So the Caribbean is therefore disproportionately affected because we're the most tourism dependent region in the world. Tourism accounts for 11 to 19% of GDP across the board in all our territories. And I've singled out Jamaica, Barbados, and the Bahamas because we're in the top 20 globally for direct and overall national development in terms of dependence on tourism. And we're seeing there that those countries, tourism accounts for 34 to 48% of total GDP. So the high dependency on tourism obviously increases the vulnerability of Caribbean economies. To drill down even further, a survey conducted by the Caribbean Hotel and Tourist Association in mid-April 2020 of businesses within the tourism sector were asked, is your business open? And if so, are you actually conducting business? 61% of them said no. A mere 13% said yes, and 26% said partially. So that tells you how grim the situation really is. Asked further about remuneration to staff, are you even paying your staff a portion of what they used to earn? So we have 64% saying yes, they're paying a portion, and 36% indicating that they weren't paying their staff anything. So of course, what this means is that we have a number of households who depend on tourism for their livelihood, who are now in a serious state of loss of earnings completely or loss of diminished earnings. Of course, we know that this has a direct impact on their disposable income, their ability to care for their children in terms of routine health needs, in terms of provision of services that allow them to access education, and certainly because of the relationship between social factors and economic factors. What the learning has shown us is that once you have persons who are experiencing all kinds of stressors, and economics is a huge one in terms of loss of earnings, frustration goes up, the disciplining strategies that they use towards their children sometimes becomes harsher. Sometimes they resort to all sorts of other types of activity to earn funds, which results sometimes in children being left unsupervised. And when children are unsupervised, it creates an opening for greater access for them to be exploited, whether in person or online. Because what we have seen as well, even though we have no specific data yet, but preliminarily, we have seen that because children are largely in an unstructured environment, their use of online and social media platforms has gone through the roof. And so all sorts of things now are available to them on these platforms, and they are in fact engaging in all sorts of activities that normally they would not have as much time to do. So this is a very important factor. Belize gives a very good example of how our people in the Caribbean are grappling because of loss of jobs or loss of earnings. In excess of 81,000 persons in Belize have applied for unemployment relief, claiming that they have been laid off from work. Of that number, only 41,000, which represents about 51% of these persons, were approved to receive 3 payments from the 75 million that has been set aside for unemployment relief. And of course, the tourism sector, as I've said, has been most impacted by unemployment. Within Jamaica as well, we have a similar scheme known as the CARE program, meaning COVID allocation of resources for employees program. And this really was the government of Jamaica's response of providing general grants that largely target workers and occupational groups in the tourism sector. So of course, persons who serve as tourist transport associations, so taxi drivers and tour buses, airport red caps, golf caddies, raft captains, independent tour guides who do water sports and all sorts of things, craft vendors and producers, they have been very hard hit and have not been able to earn. So the CARE program targets them for the receipt of grants. But Is this enough? It certainly is a start, but what it does is it points out the very precarious position that the Caribbean occupies. And if we really want to achieve sustainable development goals across the board where no one is left behind, then we can't ignore, as I said, the major socioeconomic influencer throughout the Caribbean region to ensure that our children are not left behind. So what do we need to do? In terms of my concluding remarks, I've distilled 4 key issues. First, we have to anticipate and recognize that there will very likely be a further spike in numbers of child abuse reports and cases, which we may not get to until the end of the focused attention and the preoccupation with COVID-19 and persons start paying attention to other issues again and reporting. We also need to commit to redoubling our efforts to educate children and caregivers now, right now, so that we can boost preventative measures. We need to pursue effective interventions as well that support children. And there's no support for children without support for parents, because there is that dynamic that is a constant one, and we need it to be a reciprocal and very supportive and positive interchange. And fourth, we need to create sustainable programs throughout the region that promote resilience in our children to ensure that they know that they can, in fact, get through this. Thank you very much for being a part of this webinar, and I will hand back over to Heather. Thank you.
Thank you so much, Diane, for sharing this really interesting information with us today. I'm going to switch the screen back. So we do have a few questions. Just to follow up on what you were just saying about recommendations for preparation now, are there any examples of programs for resilience, for example, or parenting programs that you would recommend?
Yes, so we do have a National Parenting Support Commission that is established and really runs through the communities. And so they're splintered across the island, where we have what we call parenting mentors who live in the communities, and they are there on the ground to support parents who have a need, and even when the need isn't manifested, to support parents who appear vulnerable because of certain indicators, and they reach out to these persons at the community level to help build their capacity. Outside of that, we do have online interventions of all different sorts that have been going on, particularly since COVID-19, to engage children and particularly students in terms of having them deal with what are some of the things that bother them now, and having very specific coping mechanisms that target solutions explored with them. Pre-COVID-19 as well, of course, we had very on-the-ground, face-to-face interactions through various scenarios, whether it be town halls, community meetings, and other opportunities where specific information is delivered to groups, again, that appear targeted, and certainly the response is given if persons identify that they do have a need and they reach out for the help.
Okay, thank you. And you may have touched on this, but could you talk a little bit about during lockdown, did social workers and pediatricians and others who work in child protection move their practices online in some sort of telehealth way? And what is the situation now with in person-to-person contact with child protection workers?
Okay, so largely a lot of things went online or went in a distance kind of arrangement. So for example, in our local Ministry of Health, we have what is called the Child Guidance Clinic, which is a clinic that's established and staffed with both psychologists and psychiatrists who treat with children who have mental health issues across the entire range. So it could be as severe as suicidal ideations, or on the lower end of the spectrum to include, self-esteem issues, self-imaging issues. And so largely these sessions were being conducted via telephone. But what we had when everything was just, thrown upon us is that we had a lot of missed appointments initially and then postponed appointments. But then the services did reach out to children and parents who had scheduled appointments to say we can now transition to doing this on the telephone so that we can at least get some intervention going. Outside of that as well, We do have a caucus of guidance counselors, school-based guidance counselors, in some of the schools that had particular problems and were in a particular on a particular spectrum of the need for special and continued intervention, where the Ministry of Education ensured that those guidance counselors were available to reach out to some of the parents of these students and the students themselves to just do a check-in to see what was happening to ensure that there was some kind of contact. What has happened now is that we are transitioning slowly back to face-to-face interactions. And so some of the more critical cases that it is deemed, better to do a face-to-face interaction as opposed to a telephone, those are being seen face-to-face, but we still do have some telephone sessions being conducted.
Okay, thank you. And here an attendee is asking about any special supports that are being given to caregivers and children in special care settings. I assume that means foster care or institutional care.
Yes. So in terms of foster care, the support that those parents would get would fall under the same system as those who live in state care homes. So there was a protocol that was rolled out by the agency that treats with children who live in alternative placements. Just in terms of, first of all, the first stage was how do we secure our base? So a lot of focus was placed on that time at, developing their awareness of what was happening, educating them about the virus, how to stay safe, social distancing, and so on. And we have transitioned a little bit further on, whereby psychologists who are assigned to that unit are in fact dealing with issues that are red flagged by the operators of some of these facilities that need their urgent intervention or need that extra boost that they can't provide. But what has happened is we have had sort of a backlog in terms of some of the cases being reached in very real time because, again, face-to-face interventions were suspended in terms of face-to-face with a professional outside of the facility. And so what has been happening is there has been a lot of remote support given to the managers and the carers who are in these particular facilities so that they can support the children a little bit better until the psychologists can actually get in there and the social workers can work with them. So the face-to-face had been suspended, but that is now being re-engaged and redeployed with a focus on the most vulnerable being reached first.
Okay, thank you. And here's a question about you were talking about the economic hardship that you're suffering there. Um, how long is the government's financial support planned for with the tourism taking such a hit? Is there a long-term plan to help families?
I know that it's an ongoing program. I'm not aware of an end date as yet, but what happens is that persons can apply online on an ongoing basis on the COVID-19 website that the government has created. Of course, a needs assessment is done to determine whether or not the person qualifies for the grant. And so the fund is, well, it's not a bottomless fund, but there is an assessment made as to whether they can apply and if they can benefit. And then there are various iterations of it. I can't say when it ends, but it won't be indefinite, that's for sure. Because we've had other kind of grants that have been, have come up on the scene for just a very short time, open for a window of 3 months. It's a one-off payment just to assist because you are a pensioner and you have missed a particular payment or you're having extreme hardship. So I can't say how long the care program will actually last, but it's in place for now, and we anticipate and see how long it will continue.
Okay, great. Thank you. And here, an attendee is asking if private psychologists and psychiatrists are also engaged to provide services for children, parents, and caregivers during the pandemic.
Uh, they are, but not necessarily by the government. There are, I would say, two particular cohorts that we could look at. You have exclusive private practitioners who have their own services and they work privately, as the name suggests. And then you have persons who do have a private practice, but they also are contracted to the government to provide certain services. So there is a hybrid whereby some are and some are not.
Okay. Thank you. And maybe if you could just talk a little about what's happening now in terms of opening up the country,
Mhm.
tourism starting back up, and also the plan for schools in the fall.
Okay. All right. So we're brand new to opening up bit by bit. Jamaica, for example, we opened up on the 15th of June. And it's a phased stage. What has been happening, and in other territories across the region, is that there is testing upon entry. And so it's not just temperature checks at the ports of entry, but actual booths and stations where you can have a full COVID testing. We have implemented geo-tracking as well, which has the Ministry of Health being alerted if the person who arrives into the island moves out of a certain zone within a specified period, if they are a resident, or within a specified range if they're a visitor, because we have established what we call safe bubbles, if you will. So if you're here for vacation, it is anticipated based on what you disclose on arrival that you won't venture outside of certain towns and parishes. So we have geomapping in place to deal with all of that. And we also have the whole home isolation, which has been built out quite a bit more. So on arrival, for example, as a returning citizen or resident of the country, you have to self-isolate for a period of 14 days at home. Of course, if you're manifesting any symptoms, or you in fact test positive, then you have to be quarantined in a government facility. And it's much the same in a lot of the territories, because while flights have been allowed to come in, it's not the usual itinerary that would have normally obtained. So it's on a phased basis, and permission is granted to certain carriers and so on. And so we're doing it very slowly. In terms of what we expect come September, which is when our new school term starts, there is still some element of uncertainty. There is a general expectation, however, that has been expressed that students will return to the classroom, the physical classroom, in September, but different schools are considering different modalities. For example, some of the options on the table are that you will return to the classroom as you normally would, but wearing a mask, observing all these protocols. Or there'll be a mixed modality where part of the week you're at home doing it online, the other half, or the other 2 days, sorry, you are doing face to face. Or whether it is the teacher alone that's in the classroom and doing Zooming or, web meetings or whatever it is, beaming to the student at home. So there is still some uncertainty, and we anticipate that these details will have to be worked out throughout the summer break.
Okay, thank you. And just one last very quick question. Someone's asking about a symposium that you mentioned, the PAG or J symposium, and she's asking if it's open to the public and how others can join.
Certainly, it's the Pediatric Association of Jamaica. It is open to the public, and what I could offer to do, Heather, is I could share those details with you, and then you could pass it on, if you will. It's tomorrow evening at 6 p.m., I believe, Jamaica time.
Okay, wonderful. Thank you. We're about at time, so I just want to say thank you again to Diane for sharing all this information with us today, and thank you to everyone in the audience and for joining us, and also for your questions. If you have a question that we couldn't get around to, or you think of something, please feel free to reach out to us at resources@ispcan.org, and we'll try our best to get your question answered. One moment. Oops, sorry. Me go back. We would like to encourage everyone to become a member of ISPCAN if you're not already, so that we can continue having webinars like these. Our member benefits include discounts to our congresses, which we're planning to resume in 2021. We offer several membership levels, including our new associate membership for just $35 a year. We'd also like to invite you to visit our COVID-19 resources page for a variety of resources for professionals, parents, and children, and to learn more about our upcoming webinars, including a webinar next week on COVID-19 and children with disabilities. To learn more about ISPCAN, please visit us at ispcan.org, and a reminder that a recording and the slides from today's webinar will be posted on our website shortly. And again, if you have any questions or comments, please contact us at resources@ispan.org. Thank you all again for joining us today. Please stay safe and healthy and have a great day or night, depending on where you are. Thank you again, Diane.
You're welcome. Thanks, everyone. Bye.
Okay, thank you. Bye-bye.